All right. Good morning. We're on, right, Shanette? Okay.
Yes.
Good morning, CFF. Thank you all for joining us this morning to talk about this important topic. You know, this is painful for me. I can't see you. You know, I love to see you all, and I can only see myself. But this morning, we are going to talk about COVID-19 vaccines and help you all kind of know what you need to know. COVID vaccines have started to roll out across the state. Currently, in that kind of tiered decisioning process, we're in the 1A, so the very first phase of vaccine delivery, really targeting medical professionals, folks in long-term care facilities, first responders. But my understanding is we're getting ready to move to 1B, which will open up vaccines to a broader category of our staff. I know that some of you are ready. You're waiting. You know, when can I get in line? What's going to happen? Where do I go? Of you have questions and concerns about the vaccine. Is it safe? Was it studied enough? Were people who look like me part of the trials for this vaccine? And so as we in the management of the organization work really diligently to figure out how to get you vaccinated, we also wanted to help you with your decision-making process. So I reached out to Dr. Shauna McIntosh to join us this morning. She is on call. So when you see Dr. McIntosh, you'll see she's in her white coat. She's ready to deliver a baby at a moment's notice. She's a graduate of the University of Maryland Medical School, a board certified physician who has practiced at St. Francis Hospital since 2009. Dr. McIntosh is also president of the National Medical Association, which is the largest and oldest national organization representing African American physicians and their patients. We are also fortunate that Dr. McIntosh is on the board of Children and Families First, has been on our board since 2007, and I am honored to call Dr. McIntosh a friend. So here's the plan. I'm going to yield the floor to Dr. McIntosh, and she'll give you some overview background on COVID-19 and the vaccine. And then we will open the floor to your questions. Because this is a webinar, not a Zoom, you have two ways to ask questions. One is through the chat, and the other is by text. I'm going to tell you a phone number, so get your pencil, write it down. I'll remind you later in case you forget. It is 302-932-8320, 302-932-8320. And Shanette Hinson is helping us monitor the chat. So when we open it up to questions, we'll try to get to as many as we can, as long as we have Dr. McIntosh with us. So without further ado, I'm going to turn it over to Dr. McIntosh. Welcome.
Hi, good morning, everybody. Thanks for joining in. I have to say this is probably my third webinar that I've participated in since the COVID vaccines have become available. And the reason why I keep signing up to do this is I really want to educate people about this vaccine. I personally have been vaccine adverse my entire life, mostly because I hate needles. I mean, I believe in childhood immunizations, but when my job said, oh, you have to get the flu vaccine, I was always the one on the very last day getting the shot. Because I was trying to avoid it and hoping that my paperwork had slipped through somehow and that they would not know that I wasn't getting it. Total change of heart when the vaccine for COVID came out. I started paying attention to what was coming out in our medical journals. I was paying attention to what was happening in Great Britain, as well as coming out of Germany. A lot of the vaccine development has happened in Germany. They were ahead of the curve on vaccine development. And just keeping my ear to the ground to see where I would land on it. I would say sometime in late November, early December, St. Francis Hospital polled us and they said, there's a vaccine, are you going to take it? And my knee jerk was, no, I'll wait. And as more evidence came out and more some more of the clinical trial information came out, I warmed up and I said, you know what, I'm going to do it. This is what I affectionately call my shot of hope. And the fear of needles or fear of the unknown became replaced with the only fear being that it won't work. And if I can leave you with any thought today, this is what we have. We hope it works. The only fear we should have is that it's not going to do the job that we're hoping that it does. So far, things look, they're very promising. This vaccine technology has been around since 2005. I am proud to say that the woman who actually discovered this, the person who actually discovered this was a woman from Hungary. She had fled here from communist Hungary. She came with her 2-year-old daughter, and inside that daughter's teddy bear was $1,200. That's what she came to our country with. And she, along with Dr. Weissman at UPenn, developed a technology for mRNA vaccines. She didn't get much recognition. In fact, was told that she was not research material. She was ousted out of UPenn. Dr. Weissman still there, and he continued to do the work on the vaccines, and he did the research mostly on animals, and they didn't really even pay attention to what he was doing until COVID came out, until COVID came onto the scene. Meanwhile, I believe he was German, a molecular geneticist had been reading some of the papers by the woman at UPenn, and I will tell you her name. I think it's Catalina Karina, I believe is her name. And yeah, Karinko, sorry, Karinko. He found her papers and built upon that, the research that she had performed. And in 2010, he founded Moderna, whose vaccine has been approved. The people who own Moderna now are billionaires. Karinko she's a millionaire now. She's made about $3 million from this discovery. But all of this to say that for 15 years, we've had the technology. The pandemic happens, and this vaccine technology that had been used to try to find something for the flu, try to find something to help with Zika, but nothing really took off. Now they were willing to really see if it would work. When we take the flu vaccine, we know that it's about 50% effective in decreasing the chances that you will become severely ill from the flu. The rates of protection that we're seeing with the mRNA vaccines has been incredible. It's like 95%. So much so that the people who were included in these trials by Pfizer and Moderna, the ones who were in the placebo arm, placebo meaning they did not get the actual vaccine, they actually received a sugar pill or sugar vaccine. Instead, they are now saying, is it ethical to not offer these thousands of people the vaccine because we know it works so well? So they are completing the phase 3 trials, where a lot of discussion going on whether or not we should continue them based on withholding not medical information, but withholding the vaccine for people who are in the phase 3 trials. And we've rolled it out to the community. Right now, as Kirsten said, we are in phase 1A, which means essential healthcare workers, people in long care health facility, EMS workers. Those are the target groups right now. But 1B is being phased in this week. And you may know that this weekend they had an event at the DMV, and a lot of people were vaccinated, sort of out of phase, but we were getting the next target group, which is the people who are 65 and older. So when your number gets called, I would say show up. The vaccines are free. Free, and that is being paid for by our taxpayer dollars. We're hoping that by June, every American above the age of 16 has had the opportunity to get and to be vaccinated. How long does the vaccination work for? We don't know. We're hoping at least 4 months. We might find that it lasts longer. That will all be determined by the clinical trials that are ongoing and also by the population studies that are happening now. What we do know is that if you actually have COVID or you've had COVID, you're probably safe for about 90 days from that time as far as being reinfected. If you have had COVID, we are still recommending that you get the vaccine because 90 days is not that long and you need to have more of an immune response. So if you've had COVID, you need to wait 10 days before getting the vaccination. If you're living with someone who has COVID and it's your day to get the vaccine, you can't, only because you're not supposed to be out in public you're still supposed to quarantine 10 to 14 days after being exposed. But there's no health reason, medical reason why you have to. It's just you're supposed to not be in public during that time. Right now, there are 2 FDA vaccines that are out there, FDA approved vaccines. One is the Moderna and the other one is the Pfizer. Pfizer was created with the help of BioNTech, which is a German vaccination company, and they partnered with Pfizer to come up with the mRNA vaccine. Pfizer has a challenge of needing to be refrigerated at, I think it's minus 300 degrees Fahrenheit. Once you thaw it out, you have 5 days to use it. And right before it's given, it has to be reconstituted or mixed together, and you have 6 hours to give it. So it becomes a challenge if you're trying to vaccinate people and they don't show up for it. That shot has to be wasted if you don't have someone else to give it to, if you don't have a plan B for it. The Moderna lasts for 30 days in a refrigerator after it's been thawed, and it only has to be frozen at 3 degrees Fahrenheit. So big difference there as far as storage and how long we have to use it. Who shouldn't get the vaccine? Right now, it's people with severe allergies to any of the components of the vaccine. And I would suggest that if you have an allergy to vaccines or to certain components of medications, for instance, polyethylene glycol, which is one of the components in the vaccines, I would suggest that you go to the website, the CDC website, because these are chemicals that people that they can be allergic to that are contained in the vaccines. If you're allergic to rubber, if you're allergic to eggs, iodine, those are not contraindications. You can still get the vaccines. But when people have, let's say, received a medication or another vaccination and they almost die from it, I'm not saying itching, I'm not saying you felt lousy, I'm saying a reaction where people are talking about intubating you, then you really need to go to the CDC, look at that list, or go to your healthcare provider and say, hey, I had a reaction to IV labetalol. One time when I was in the hospital, should I avoid the vaccine? The answer is no, but in a case where you have had a life-threatening allergy, you really do need to know what it was that elicited that response, because the allergic reactions to this vaccine have been very rare. Having said that, since this is a new vaccine and it was pushed out as under the emergency use plan from the FDA, we are still learning about it. And so we do recommend, not recommend, you have to be monitored for 15 minutes afterwards. And if you've had a severe allergic reaction to a medication, then they want you monitored for 30 minutes, and you should not go to one of the drive-throughs. You should actually go to a hospital or to your physician's office to have the vaccine given so that you can receive emergency care if needed. Pregnant women, breastfeeding women, all evidence is pointing towards it is safe to use it. I tried finding out whether or not it's excreted in breast milk, and I have not found that answer yet. I even spoke to the neonatologist here today, and she was unaware as to whether or not it gets excreted in breast milk. But I will tell you, most vaccinations the antibodies that are produced will be excreted into the breast milk, which is good because it actually protects the baby during a time when the baby's immune system is not up to par. As far as population studies, what I think is important for people to know is that there were 43,000 people tested, and of those, about 10% were people of color, African Americans specifically. And they also had, it was a little more as far as the Hispanic participants. And they did not show any difference in response rate or adverse reactions in any of the ethnic groups. And for comparison's sake, most trials have about 5% African-American participants. This one they had 10% in Pfizer and 10% in Moderna's. So in Pfizer's, it was, well, for both, it was about 3,000 African-Americans in both studies. And I believe Hispanics, I think it was 13% in both studies. So it's fortunate that we're not showing racial disparity in responses. We're not showing a gender disparity, even age. Age is not making a difference. With the flu vaccine, people who are 65 or older have to get the super vaccine in order to get their immune systems to rev up. We're not seeing that there's a problem with the people who are 65 and older in mounting a response to the COVID vaccine. And right now we're looking at numbers of 96% effective for Pfizer and 94% for Moderna. Right now we have a 2-shot process. You get the first shot, and then 3 weeks later you would get the Pfizer dose, if that's the one that you had, or 4 weeks later for the Moderna. You cannot interchange it. If you get Pfizer the first shot, you have to get Pfizer for the second shot. The interchanging of it has not been studied and is not recommended. And quite frankly, people would probably stop you from trying to cross over into the other medication. Trying to think if there's anything I've left out. Should you have a reaction to the vaccine that's severe, we are supposed to report it to the CDC. We are still taking in data and trying to figure out what kind of reactions are out there and how severe and who is it affecting. I received my second dose about a week ago, and I am getting alerts on my phone asking me to report in what my side effects are, how I'm doing with the vaccine. So the data is still being collected. Most people will have some kind of reaction. The first shot, they may or may not have some just sort of feeling a little lethargic. They might have a low-grade fever, soreness at your arm. After the second shot, people tend to have more symptoms, usually maybe some nausea, some diarrhea, headache. So do not be surprised if after your second shot, you're feeling like you're feeling the effects of your immune system working for you. I think that's all I have. I am more than willing to answer any questions that are out there. And if I can think of anything that I've forgotten, I will blurt it out.
Thank you, Dr. McIntosh. You can hear me, right?
Absolutely.
Okay. I've prepped a few questions. You did a great job giving an awesome overview. Can I just ask a few questions? One is around, these vaccines were developed under Operation Warp Speed.
Yeah.
Which I know, I've heard from folks makes people feel a little hesitant that warp speed, this happened really fast. Can you talk about whether all kind of the regular standards of a trial were included in the study of the vaccine?
So there were no steps that were skipped as far as studying this vaccine. They still had the phase 1, phase 2, phase 3, which is typical for vaccine development. What they got rid of was the bureaucracy that was involved, number one. So when you are applying for drug approval, it can sit in the FDA's office for months, weeks, months, waiting to be approved. With the pandemic going on, we didn't have time for that. So there was a priority given to vaccine developments for COVID. So we got rid of the bureaucracy. The second thing was that we were collaborative. So we did not just have Pfizer saying, I want to make the vaccine and make tons of money for my shareholders. You had Pfizer working with companies in Germany, working with companies in China, and they were all sharing this information. So there was a worldwide collaboration. And so you didn't have to redo things. For instance, Pfizer didn't do animal studies. They didn't need to, they've already been done. So we were able to streamline the process to get this approved. And you'll have use under emergency situations when you have a healthcare crisis that is such that we don't have any alternatives and we need to get things out to the public because it's our only chance of gaining some control over it. Warp speed is probably wasn't the most sensitive name they could have given, but the guy, one of the major researchers is a Star Trek fan, and that's why he called it that, Operation Warp Speed. And the intention was to get 3 million doses produced and distributed by January 2021. But we're falling short of that for a number of reasons. But when you think about warp speed, he was talking about production and putting it out there, not the development. So we've trimmed the fat in the development and we've collaborated, and people had a single goal, which was getting this pandemic behind us. Usually things are profit driven or ego driven.
One of the other things that we're hearing about, I think, from both the community and our own staff is vaccine hesitancy, particularly in communities of color. So you talked about how the vaccine trials included, it sounds to me like many more representatives of the African-American community, the Latinx community than we typically see in a trial, and that the health impacts were the same across populations. Can you talk a little bit about why that vaccine hesitancy may still exist for folks?
Okay. So it's just based on the history. I think Tuskegee stands out in a lot of the minds of African Americans, especially the older ones who actually watched it unfold. And the Tuskegee experiment involved these poor sharecroppers in Tennessee who were studied. There were 600 recruited, and they were studied to understand the effects of untreated syphilis. So these men, some of them had syphilis at the onset, some didn't, some contracted it during the trial, but what our government did was not give them the penicillin, even though penicillin came on the scene in the early 1940s. They not only did not give it to these men, they sometimes lied and said they were treating them, and then sometimes would prevent them from getting treatment because they wanted to know, well, what happens if you don't treat syphilis? So they were used pretty much, they were uninformed about the risk of this trial. And when we think about a dark period in research in our history, we think about that. We also think about what happened in Guatemala, where the US government actually did infect people with different sexually transmitted diseases because they wanted to see, well, how effective is this penicillin? What happens if we give someone syphilis or gonorrhea, we treat them, can they get it again? And they were basically using people in a small town in Guatemala as laboratory animals. They knew better than to do that on our shores, because at that time, the Nuremberg trials had happened, and we had the Nuremberg Act that said you cannot use human subjects without their express consent. By the way, that did not change what was happening in Tennessee, but they knew not to start it here. No papers were ever published from the Guatemalan studies, but it leaves a bad taste in your mouth. And you also think about the forced sterilization of the Puerto Rican women that occurred during 1920s, 1960s in this country, eugenics. So there's a strong past, but I'm going to tell you what's different nowadays is that at every phase of this vaccine development, we have been there. We meaning physicians of color, researchers of color, nurses of colors, investigators of color, lawmakers, policymakers. Every step of the way, there was someone looking out for the interests of communities that were under and sometimes not represented before. This is why you have so many Black physicians and Native American, Latinx, African American doctors and nurses and policymakers out there saying, we are behind this. Nobody's paying us to say it. We just see the writing on the wall. This is one of the first times in history that we have been included at every step of every stage of the game in meaningful ways. So we've had people looking in on every aspect. We have fought hard to be at that table. We have fought hard to make sure that when the vaccine rolled out, that it wasn't just the privileged few, but that they were going to be there in the communities, testing and treating and offering educational material. So it has been an uphill battle, but we're there. And now that we have created a space for you, please show up, please. This has been there's been a lot of work, energy, time given to making sure that we don't repeat our past. And the only correlation I can draw between the COVID, what's going on with the COVID vaccines and what happened at Tuskegee is that if you don't allow yourself to be treated, you are withholding treatment the way that the government withheld treatment from those young men.
Thank you. I have one more question, and then I'm going to turn it over to Shanette for some. I've seen some questions come through the chat. One of our staff asked about, whether if they had been ill in the past, like in December, someone had bronchitis, are they safe to get the vaccine now?
Sure, as long as the person's not febrile, and as long as we know that she or he does not have COVID, absolutely get the vaccine. In fact, someone with lung disease should be getting the vaccine because we don't want them getting COVID. That could further compromise their lungs. And out of all the reactions that we hear about from the COVID vaccine, respiratory ones are not there. So if you're having a bronchitis, it's not going to make your bronchitis worse. From all that we know. You might have a headache, you might have a fever for a couple of days after getting the vaccine, you might have some body aches, but as far as feeling like your lungs are more compromised, not seeing that. So I would say to that person, no, you should get the vaccine. Of course, talk to your primary care doctor about it, because if there is a component of asthma, sometimes they have more of a reaction to the vaccine. And so this is not a person that I would say go to a drive-through. I would say get it at a healthcare facility or someplace where there is medical attention immediately available. But that person needs it probably more than I did.
Great. Thank you. Shanette, can you start helping us out with the chat?
Sure, absolutely. The first question that we have is, Are you able to discuss how long it takes for the vaccines to work once you receive both of the shots?
2 weeks. It's 2 weeks. We're seeing a good immune response. And that's after the second dose. Not so clear what happens after the first dose. I think they don't want to give people that false sense of assurance that they are protected. So it's 2 weeks after your second dose.
All right. And for those who receive allergy shots every week, should they get the COVID-19 vaccinations?
They should, but you have to wait 14 days. You should not co-administer, or you should not have the COVID vaccine within 14 days of having another type of allergy shot or vaccination. Are you saying these people are weekly? Is that what I heard?
Correct. Yes.
Yeah. So they should probably speak to their allergist about trying to modify that a bit before. I think they should get the COVID vaccine, but they might have to skip a week of their allergy shots based on what we know right now. People who are getting RhoGAM or people who are getting immunoglobulins, some people have plasma infusions, those are not affected by the vaccine.
All right, thank you. And have there been any deaths reported from the COVID-19 vaccine?
I did not see any deaths reported from the COVID vaccine. And reviewing the literature that was on the CDC and also Pfizer and Moderna's website, I saw that 8 people in the placebo part of Pfizer ended up with COVID, and 1 person in the vaccinated part ended up with COVID, but they did not report any deaths.
All right. And how long is the vaccine effective once you receive both of the shots?
So we don't know. We are right now, they're saying at least 4 months. The hope is that it is at least 6 months.
Okay. And are you able to talk about some of the side effects and who did they test the vaccine on first?
Who did they test it on first? I don't know that answer. I don't know that answer. Do they mean as far as racial or gender?
They did not specify.
Okay. Volunteers, that's what I do know. I just know that the final population was 10% African American, and that they had 43,000 participants, but I don't know who they actually tested it on initially. I will tell you, Pfizer did not use animals. They went straight from the laboratory, straight from the bench to giving it to their participants, but they were volunteers. There was a second part of that question.
Shauna, can you say a little bit, because you just brought it up and I saw a question in the chat about skipping the animal trials? It's because they had already been conducted by someone else, right?
Absolutely. Oh yeah, and Wiseman at UPenn has been testing it on animals for the last 15 years.
Okay.
But on top of that, they had places around the world that were already doing the animal trials.
Right. Thank you.
So they just drew
clarifying
upon
that.
Yeah, they drew upon that information. There was another part of the question.
Sure.
The
side effects.
The side effects. Sorry. Typically, it's fever. A fever of 101 is not uncommon. Nausea, diarrhea, feeling lethargic. Definitely pain at the site of the injection or a local swelling in your arm where you've had the immunization. Those are the top side effects, and they tend to last 24 to 48 hours. So here at St. Francis, the majority of us took either Motrin or Tylenol to pre-medicate ourselves before the vaccinations for the first and the second one. We've had one colleague who was pretty out of it for about 2 days. I will disclose that he had a really bad case of COVID back in June. He was very sick for like 3 weeks, out of work for about a month. So he had a bad case of COVID. So I'm not sure if it had to do with his own body's reaction and his antibodies that were already present. But he got a second dose. He said, I'll never do it again. But he has his card showing that he has his 2 doses. But it's generally headache, body aches, low-grade fever or fever of 101, nausea, diarrhea.
And Dr. McIntosh, my understanding is the reason for those side effects is really your body mounting its immune response. It's not because of the vaccine. Your body is actually figuring out how to respond to the vaccine and build the antibodies that you need to be protected from COVID.
Absolutely, it's your body at work. And something I didn't mention is that this vaccine is it's a one that's based in the laboratory. Does not have anything from the live virus that's in the vaccine. So you can't really get COVID from the vaccine. What they've done is they have taken one of the spike proteins. I think you've all have seen the picture of the coronavirus. It has that crown of spikes, and those spikes are very unique to the coronavirus. So the vaccine, to develop the vaccine, they took the genetic material used to create the spike protein, and they artificially recreated it. Messenger RNA is how our cells know what to do. So you inject that into the person, the genetically laboratory produced fake mRNA based on the real thing, but it's fake. Give it to the cells. The cells say, I don't mind making that. I'm making a lot of other proteins. I'll make that, sure. They make the protein, put it out on its cell wall, and our body goes, wait a minute, that's not us. We got to attack. So you start to have an immune response, and that's where the fever comes in. And your body is so busy trying to make these inflammatory cells so that your body goes, we're not letting that invader in, that you can start to feel ill. What happens to the messenger mRNA after it gets produced? The actual messenger RNA, the actual stuff that's been injected into you, actually disintegrates. So it goes away, disintegrates.
It's not changing your DNA, right?
No, not at all. It's not getting
a misconception that's out there. Yeah.
Yeah, no, it doesn't do that. It's not part of your own genetic DNA. It doesn't get integrated into it. It's almost like the vaccine saying, hey, I know you're doing a lot of, if you're doing a lot of cell making today, do you mind just making this for me for a second? And your body goes, sure, I'll do you that favor. And then it's done with it. So that's why we don't really know how long this immune response is going to last. How long will those antibodies actually keep being produced so that we'll have the immunity? Don't know, but we will find out. But we know at least it works 4 months. We don't know how much longer it'll stay around.
But the thinking now, sorry, Shanette, if I'm stepping on your toes, but the thinking now is not that we will need to be vaccinated again. The hope is that if enough folks are vaccinated, it will eliminate or greatly reduce the spread of the illness, and we wouldn't need to keep being vaccinated, or we don't know that yet.
We don't know that. We can't say that yet. What we're working on, or what people at UPenn and around the world are working on right now, is actually developing a single dose vaccine. You are correct. The more people that we have vaccinated, I've heard that we need at least 74% of our population vaccinated in order to get that herd immunity that we need. This is why I call it my shot of hope. I'm just hoping this works, but how long it works, whether or not we need boosters, we don't have those answers yet. It's too soon. It's too soon to start predicting what's going to happen. We also are hoping this vaccine actually is going to cover the variants that are coming into this country. We have at least 50 documented cases of the COVID variant. It was first discovered in South Africa, somehow made its way to the UK. One of our challenges is that if you know anyone who's been tested for COVID, who's been positive for COVID, we haven't put the money into deciding, well, what kind of COVID do they have? So without knowing whether or not people have the variant or the run-of-the-mill strain, we are not really going to know whether or not the vaccine is protective. We're not collecting that data yet.
All right, thank you. Why does it seem to be a discrepancy in the number of vaccines said to be sent to a particular location or distributor versus what a provider actually gets? This increases questions that something is being done unethically or creates more unrealistic theories about what's really happening. And this gets shared on social media and it goes on and on from there.
Okay, so when it comes to how it gets distributed, I have to say I'm not a part of decision makings. I don't know that part of this puzzle at all. I have pretty much focused on the safety of the vaccine, getting the word out to people about getting it. I think there's a lot of politics going on behind the scenes as far as how it's getting distributed. I know about the DMV vaccination thing that went on this weekend, and no one seemed to know about it. It was all word of mouth. You couldn't find information about it. I wish I could answer that question for you. I will say, do not let that deter you, because the science and the medicine have not changed. That's all. That's politics. That's policy. That is disorganization. We've never been confronted with the pandemic before. There are a lot of factors that go into storing in particular the Pfizer vaccine. But I would say stay away from conspiracy theories about this, as far as whether or not to protect yourself from the virus. It's a separate issue. Like how vaccines get to where they're going. I'm staying with the science. I'm staying with the medical recommendations. I am living and breathing this stuff almost every day, in particular because I'm taking care of two patients, my pregnant patient, and I'm taking care of the unborn child. I don't want to do anything that's going to harm a baby that's not even been born. Also, as a member of a family, I'm trying to make sure that I am making recommendations to keep my family safe, my friends safe, my community safe.
All right. Should a type 1 diabetic get vaccinated?
Absolutely. Anyone who's at risk for infections, and that would include people who have cancer, people who have lupus, people who have diabetes, and people who have sickle cell. You all are the people that really need to have the vaccination. Again, this vaccine is not going to give you COVID. It's not like some of the vaccines, which are the actual virus, but the virus is diluted out so that it doesn't make you too sick. This doesn't have any live virus in it. You need the vaccine. You need to definitely get the vaccine.
Okay, and have you heard anything about if a person has a blood type O, are they less likely to get sick from COVID?
I have heard that, and they're saying that the blood type A is the less evolved blood type. And so there are definitely studies out there showing that if you have the O blood type, that your symptoms will be less severe. So there is some science behind that. And they're saying that O is the evolved blood type, A being the first, and O being the evolved, new and improved blood type.
All right. And after you are vaccinated, should people still be as diligent with the COVID precautions?
Absolutely. Absolutely. Again, this is the shot of hope. We're hoping that it works. We're hoping that we achieve some control over this pandemic. And so it still requires us to be vigilant about social distancing, staying 6 feet away. It's about mask wearing. It's about limited or no family gatherings. The vaccine we don't know if it actually prevents you from getting it. We're just hoping that it will help to decrease the transmission rates and that it will prevent you from getting a severe disease. The unknowns are, if I get it and I've been vaccinated, okay, sure, I feel fine, but can I give it to Kirsten if I go to her house for dinner, right? And if she's not vaccinated, I look good, I feel great, but now I have passed it on to someone who hasn't been vaccinated. So it doesn't really mean that you should change your practices right now, and definitely not this early on in the vaccination process.
Right. And we're certainly hearing that there are different strands of the COVID-19. So will the vaccination cover the other strands, the second strand of the of COVID?
Yeah, and so that's what I was touching on earlier, that we, right now, from the reports out of London, it seems like it probably is going to give you some protection against the new strains, but we don't know that. And part of the challenge in America is that we're not really typing the COVID strains that we're picking up. So if I test a patient and she's positive for COVID, that's all we know. She's positive. We are not doing the research to show, oh, she has this variant. We have not put money into doing that yet in this country, but from what we're learning out of London, out of England, it seems as though there is going to be some protection against the variants.
All right. So one person had asked, after they received the shot, they have a reddish color. Someone else had mentioned that at the injection site, or the arm where they received the injection, their arm felt heavy, but then that went away. And they were just wondering, is that all normal?
That's so normal. That is all normal. Swelling, redness, pain at the injection site. I've even seen a bruise, small, but a bruise at the injection site. For that, take Tylenol. I know people are saying, oh, we have to avoid Motrin. You don't have to avoid Motrin. But ice to the area and taking Tylenol or ibuprofen would be helpful. I also pre-medicated myself, meaning I took a dose of Motrin before I received the shot on both occasions. With the first shot, I had absolutely not one single side effect except for tenderness in my arm, and it wasn't even that bad. After the second dose, I felt, I keep saying to people, I feel like I was drinking cheap champagne all night. It was the nausea, I had a headache, I was curled in bed, but 24 hours after that, I was able to get back into the operating room.
All right. Are there any different rates of effectiveness or side effects for people with autoimmune disease?
Nope, not at all. Not at all. There are no differences in it at all, which is fortunate.
Mm-hmm. All right, thank you. And I'm just kind of scrolling through. I am reading the questions in the order that I received it. And if Dr. McIntosh already answered one of the questions, it means, I'm just going to skip over it. Certainly, we are recording this webinar, so you can always go back to listen again. Someone is asking, how do we know which one to take? I guess Moderna or the Pfizer?
I would say whichever one is available to you. They are so similar. Whichever one is offered to you, take it. Moderna is 2% less effective than the Pfizer. And Moderna, you cannot use Moderna if you're less than 18 years old. The Pfizer is 16 and older. Moderna is 18. But other than that, no. Just if you get a chance, take what they give you on that one.
All right. And someone's just clarifying. So you mentioned before that if you receive the COVID vaccinations, you aren't actually getting injected with the virus. And someone just wants to know, has anyone ever been tested after they received the vaccination just to prove that it is a negative COVID test? Are we?
Yes. So getting the vaccine will not make your nasal swab or saliva test positive. So you're not, the tests that we're getting at these testing sites, the PCR test and the nasal swabs, oral swabs, those are all antigen tests. And so they're looking for the virus itself. You won't have the virus in you. So you're going to test negatively unless you actually have contracted the virus. If you have a blood test and they're looking for the antibodies, and there are two different types of antibody tests out there. One is looking for the capsule of the virus. The other one is looking for the spike protein. So if you happen to get the blood test or the spike protein, it might be falsely positive. But apart from that example, having the vaccine is not going to give you a positive test. If you are positive after getting the vaccine, it's a true positive. And we don't know whether or not having the vaccine on board will help shorten the amount of time that you're sick or make you less infectious.
All right, and just to clarify, someone had another question related to that. If you receive the vaccination, have a side effect of a high fever, 101, there's no need to quarantine because you don't actually have the COVID virus. Is that correct?
Correct. Now, if it goes on beyond 48 hours, you need to be checked. So the side effects should not last more than 48 hours.
Okay.
And as far as severe allergic reactions, typically we're seeing them within 30 minutes of the vaccine administration. And that I'm talking about life-threatening, you can't breathe type of reactions.
Okay, no problem. The next question says, is the US planning on starting to type the variant of the COVID in patients?
There is a push and there are discussions about doing it. It hasn't happened yet, but yes, plans, yes.
Okay.
It's being called upon.
And Dr. McIntosh, I am sensitive to your time, and we are at 12:25. So I just wanted to make one comment and ask you one final question. And like Jeanette said, this webinar has been recorded and we'll be able to push it out to staff. The last question that I had for you is, are there resources that you recommend folks look to when they're making their decision? Aside from this wonderful webinar, are there reputable sources of information that we can share with staff, that they can share with the folks that we work with to help them answer any kind of lingering questions they may have?
So I think in regards to general questions about COVID, the CDC's website has a ton of information. When I was talking about allergies, they have charts that spell out the different components. It's about a page-and-a-half long list of components. And these are chemical names that aren't flying off of people's lips, like polysorbitol or PEG or polyethylene glycol. There's a comprehensive list of the components in the vaccine, so you can see if something that you're allergic to is on it. On our Delaware, our government's website, we have a great page that addresses the phases of the vaccine trial. We also have the COVID testing sites. We have information about our statistics, our daily statistics on COVID, hospitalizations, number of school kids who are infected. So there's a lot of information. So I would say Delaware.gov and the CDC are amazing websites for getting information. If you are African American or interested in what African American doctors are having to say about this, you might want to check out the NMA or National Medical Association's website. I have provided Kirsten with a link to a Zoom conference that we did about a month ago regarding the vaccine, just giving some red table talk about the vaccines. On the NMA website, there is a 1.5-hour seminar, and it had representatives from the government, the CDC, from the CDC, the FDA, the Latinx community, Native American community, African American community leaders in this fight. And it was such an informative webinar. I would encourage all to go there if you have any questions about racial disparities or how it affects or how it's being rolled out in communities of color. If you are pregnant or breastfeeding or thinking about getting pregnant, or you had one dose, you weren't pregnant then, and now you're pregnant and you're wondering whether or not to get the second dose, you are supposed to get it, by the way. Go to ACOG, which is the American College of OBGYNs. We have a lot of information there about the safety in pregnant patients and breastfeeding. And I will say breastfeeding women were not specifically studied. Pregnant women inadvertently ended up being studied just because of the number of people, and there were a certain percentage that ended up being pregnant during the trial. But from all accounts, there does not seem to be any harm to the infant and breastfeeding mothers, and the Academy of Pediatrics is not recommending against breastfeeding. They are encouraging it to mothers who have had the vaccine, and even to mothers who have COVID, but they're telling them to shield up during the breastfeeding times.
Great. Thank you. I'm just going to leave with one comment. I know that there were some questions in the chat around when our staff are going to be vaccinated. What I can tell you, Dr. McIntosh alluded to it, over the weekend, they've started to have some, I think they had one at Sally's that was like a soft opening of their 1B phase. We are doing our best to get information out to you as it becomes available to us. So we've had some outreach from different contract managers, trying to get lists of names. We are going to be sending out a survey, hopefully today. We love surveys. Hopefully today, trying to gauge your interest. If I called you tomorrow and said, you can get vaccinated on Friday, would you get vaccinated? My hope is that your answer is yes, and that we've addressed some of your concerns. So as soon as we know that we can send you somewhere, we will send you somewhere for sure. And that's what I have. And I'm so thankful, Dr. McIntosh, for you spending this time with us. Super helpful. We really appreciate you. So thank you for being with us today.
Oh, thank you. Thank you. And good luck, everyone. And as Hamilton said, don't give away your shot. Have a good day.
On that note, thanks, everyone.